Hey everybody, welcome back to Health Matters, proudly brought to you by Cipla. A very interesting and enthralling series of podcasts or vlogs if you're watching this via YouTube or any other channels with Dr. Konrad von Hagen, who is a World Cup winner, the team doctor for the Springboks, and a man who's still very, very involved in sport, and particularly around not only rugby, but all kinds of sports. The Proteas, Doc, I'm trying to think if there's a sport that you've ever not ever consulted to. 10-pin bowling.
My new sport's golf.
Yeah. There's plenty of injuries there as well.
I actually worked there for a whole week on the golf cart. So that's
wow.
Quite amazing. It's a very, I'm enjoying the golf.
I love that.
It's time for me to work at golf.
Exactly. Doctor, I want to talk this week about inflammation. Yeah. What is inflammation?
Inflammation is something that we all suffer with all the time. So that is when that joint of yours swell and it's red and it's hot. And it's basically just your body's immune system responding to something that's abnormal, like a bacteria or a cut or a burn. And that is what your body then responds to. Okay. And obviously that will cause then the pain, but also part of the healing process.
Okay. Let's talk about the stages of inflammation. Okay, so, and I think, I mean, you before we started this, you're talking about like twisting an ankle, whatever. The first thing I always do, I try and walk on it again, and I try and, can I keep going? Can I, whatever? But let's talk about those stages.
Yeah, I mean, we would do it on the field as well. Yeah. We need to see if you can still walk. If you're going to stay on, then or you come off.
Yeah.
So if you look like, let's take a burn. Okay. So you get water, falls on your foot.
Yes.
What happens is you've got pain.
Yeah.
And the immediate response is it's red, and it might even make a blister. Then you've got the process where all your blood vessels vasoconstrict.
Okay.
So what that means is they pull together. Because why do they do that? Yeah. They don't want you to bleed. No. They don't want it to swell. They want to protect you, and they want to make your body ready to attack what's happening.
Okay.
Then the next process is vasodilatation. So now the body says we're ready. So now the swelling will get more, because the blood gets more, everything that goes down gets more, but it's also your body sending all those healing factors to go and do its job. Then there's also the process of now the pain starts.
Got you.
So now it's there, all the pain is activated, part of that. And then you've also got the phase where your body doesn't want to move now. So it want to keep still because it's in pain.
So you could assess that very quickly. I mean, in your line of work, to be able to do that, it's almost immediate. A procedural check of what to check for when inflammation, in any form presents itself.
The acute one is just the easy one that we do. If I say the easy one, this whole process actually, those stages, is the first 2 weeks. So that's an acute inflammation process. After that's a subacute, 2 to 6, and then it goes into a chronic inflammation.
How does it present itself?
It
doesn't kind of go, here I am.
No, it's sore.
Yeah.
No?
Yeah.
Then because of all the blood now starting to come through, it becomes red.
Got you.
Becomes hot. Your swelling starts. And then also your function is not normal like it should be.
Got you. Treatment, when we look at inflammation, obviously there's different kinds of treatment that's available.
There's lots of things happening, and people talking about the old rice and things that we've used.
Yes, yeah.
It still works.
Oh, really?
And we still do it the same way. No. So your number one thing is the P. We've called it somewhat price now. So
Got you.
Protect.
Got you.
So the first 24 hours, we want to sort of protect it a bit.
Yes.
And that could be either with a strapping or a brace or so on. If you go to the price, the C is compression, which is also we can use strapping, and we can use bandages and things to compress. Very important thing just for people out there is if you do those things, just remember that you can do it too much, and then you can actually make it worse, and then you can develop something we call compartment syndrome, which can be very dangerous. It can actually be you can lose your limb. So you must be sure if you put your braces on or your strapping, and it becomes more painful, becomes white, the pulse is gone, then you're in trouble. Then that brace must come off. So if your brace is making it worse, or your strapping, take it off.
Yeah.
Then the rest, in the old days, we would put an ankle in a brace for 2 weeks. We don't want to do that anymore. No. First 24 hours, but as soon as possible we can get you going. Obviously, if it's a fracture or something worse,
Totally different.
It's a total different. This is just a little ligament sprain.
Got you.
Or ligament sprain can be bad as well. But
Yeah.
so we're not always going to put it in a brace. No.
Got you.
Ice. I still believe in ice. And my simple way I say always is 4 minutes on, 5 minutes on, 1 minute off, 5 on 1.
Okay.
So 4 sessions of 5 minutes with a minute in between.
Yes.
Reason why we don't want to put it 20 minutes on. I've recently seen one of my patients who put it on for 30 minutes. Now he's got these big burns on his skin.
Oh, no ways.
From the cold.
Yeah, of course.
It happens.
Cold burns.
So cold burns. So also you'd want to get the benefit, but you also don't want to have the problems there. And then there's a compression that we spoke about, and a normal simple bandage will help there. And then elevate. You want to get your leg a little bit higher, so that can go and help your body to get that swelling to come down.
Obviously, you've also got to be very careful in what medication to give anybody, because again, especially in professional sport, I mean, you're so limited in what you can and can't really do.
Yes.
So again, to the general public watching this, it won't be much of a concern. If you've got somebody who's seeing to it, maybe a medical advisor, it'd be totally different from being the Springboks doctor, where you're maybe 2 or 3 weeks away from playing an important game, and where drug screening is obviously a very important part of the game, and you would know exactly what you can and can't give your players.
Yes, and it's not only just for the Springboks. We forget that your daughter, who's swimming nationals next weekend,
spot on,
she might get tested.
Yeah,
you're coming to do Ironman in Gqeberha, and you're an age grouper. You're going to be tested.
Yeah.
So, and you tend to forget that you are part of that pool.
Yeah.
Even though you're not a professional, you still can get tested. Luckily, when it comes to pain, my first day, I try and not overdo the painkillers. Reason being is I don't want people to do stupid things.
Sure.
So if you now got an injury and it's you put so much painkillers in, they feel nothing and they just go make it worse.
Yeah.
And when it comes to these kind of things, I stick to simple painkillers. Yeah. People, they go and talk about the GP's choice, normal paracetamol. Still does the trick.
Correct. Yeah.
But
it's a reason why it does well.
That in combination with
something else,
anti-inflammatory, like a diclofenac,
they
all work in different pathways and they work additive, and together they give you a better response.
Amazing.
So something simple like that could be good enough. You don't have to go to the stronger medication there, and I wouldn't really advise that.
Yeah.
And also when we do that in an acute process, this is medication for a 3 to 5 day period. It's not a 3 week period.
Sure.
No.
Got you.
Because the moment we start doing that, then we are
dangerous. Yeah.
There's something else wrong.
Absolutely. Doc, with inflammation, when do you worry?
Obviously, in the beginning, and as I said, it's first 2 weeks I'm happy to see, except if pain gets worse.
Okay.
Or it's spreading.
Sure.
So inflammation can be infection as well. So that might be now going from your ankle to your knee joint. Then you should worry and get help. Very important one, and that's pain in general. If there's pain at rest and pain at night, that's not pains we should have.
Sure.
Also then, if it suddenly starts at another joint, but then we're looking at pain which are not a normal injury pain. That's showing other type pains. And then we worry about arthritis and gouts and other things. And it's not the ankle that we thought we twisted. There's something else going on.
Okay.
And then if it fluctuates, so if you load it and it's not painful, but it's painful when you don't load it, then it doesn't make sense.
No.
So then it's not an acute injury. And then if the pain is out of the proportion, and that's why, like I said, with the compartment syndrome, you've twisted your ankle and it's sore, but this pain is just severe. Then you know,
there's trouble.
There's trouble. Let's get it looked at. And then, very important, and specifically in an athlete, if the pain is not making sense to what their recovery and what they expect.
Okay.
So if this is not going as fast as they want, and it's going slow, we use a pain scale. So we would use 0 to 10 and ask day 1, ask him what's your pain. He says, Doc, it's 8 out of 10. But if it's by day 5 and 9 out of 10,
you start to worry. Yeah, that is
we're not winning.
Yeah.
Obviously, in an elite situation,
Yes.
we would get scans and X-rays and those
Yeah.
things ASAP.
Yeah.
But in the normal public, with cost and all of that,
Absolutely.
we wouldn't. But we need to know that, this is not going the way we want.
Absolutely. This is still very insightful. But besides it being, as you said, helpful, obviously from a professional's point of view, they've got structures in place to be able to assess and make those calls, as we mentioned, on inflammation. But inflammation can happen to you going on a run this afternoon, got a little bit of a side step and you twist your ankle and you think, I'm going to be okay, only to discover the next day you can't get out of bed and you can't move. Why? Because you might not have followed the simple processes, as docs explained throughout the course of this very insightful podcast. If you are watching this via any Apple device, remember to rate us, give us a thumbs up. And Dr. Konrad von Hagen will be back with some more insightful information in a very busy year that is a World Cup year for South African rugby, South African cricket, and all kinds of sport, netball, the list goes on. But we'll be back with another Health Matters episode, proudly brought to you by Cipla.